Hey everybody, this is Nathan over at Body Balance Physical Therapy. Just wanted to hop on today and I want to give you guys some information on some of the current research out there regarding some spinal imaging findings. So what this would mean is what after you have back pain and go and see your doctor and they do an MRI or X-ray or CT scan and they come back and give you a certain diagnosis. I just want to share with you how many people per age group actually have some of those same diagnoses that don't have any pain. So if we're kind of looking through, we got some degeneration, degenerative joint disease or degenerative disc disease, but lots of disc height, disc bulge, protrusion, degeneration, spondylolisthesis. With this study that they did, and I'll post the numbers and the link to the study if you want to read it below. But as we age, percentage of the number of people that actually have these things go up. So looking at here that with the people that they saw in the study that didn't have any pain and they went and took an MRI of them, somebody that was 50 years old, that 80% of those individuals in their 50s in that study had some sort of disc degeneration. Then we kind of look down here to the disc bulge. We look at a 50-year-old. That's 60% of the people in that study that didn't have any symptoms had a disc bulge. So the reason I'm kind of sharing this information is not to scare you, to make you feel like, hey, I should probably go get things checked out because I might have this because I'm in my 60s and there's an 88% chance that I have disc degeneration. Not my intention at all. This is part of the normal aging process. We wear things down, we're up, we're moving around, we do things that we shouldn't do when we're young, and then we have repetitive stresses on ourselves when we're working and doing things like that are going to be just part of the normal aging process. Think of them as wrinkles or gray hairs. I mean, you know, there's certain things that we can be proactive to take care of those, but eventually we're going to get them, correct? And so I share this information with you again, not to scare you, but to give you a little bit of hope that people have these sorts of things and they don't have pain. So we don't have to accept that you go when you have a sudden acute back pain when you're 60 years old, that the reason for that is that you have some degenerative joints. I mean, it's not to say that it's not, but we can't always make sure that is the case because we only get those x-rays when we actually have pain or MRIs when we're having pain. But, you know, you're 60 years old and you have 88% of the people who were through that study had some sort of degenerative changes that didn't have any pain. Well, even in the 50s, 80% of the people have it. So who's to say that even prior to your back pain, that's truly what the cause was, or if you already had that before. And so there's things that we can actually do with physical therapy that we take through a full evaluation, that we're able to sit there and try to figure out what caused that pain. Was it increased loading? Was it increased, you know, a different activity that you've done or a different movement that your body just wasn't ready for? You know, there's things that we're able to tease out to see if that truly is the cause of the pain, or if we can actually help to get that better by doing some of the interventions that we do here at physical therapy. So, because none of these are really going to get better on their own, with the exception of this little study right here, which talks about spontaneous regression of lumbar herniated discs. And there's different levels of herniated discs, from, you know, just a little bit of a bulge in our disc all the way to that fluid that's contained in the nucleus of our disc kind of protrudes all the way and actually comes apart and floats around in our spinal column. And what they've looked at with here with spontaneous regression is that 96% of those that sequestrate or get into our spinal cord actually resolve themselves and they spontaneously regress. That with the extrusions, 70% of those will actually spontaneously regress by themselves, and protrusions 41%, and then bulges are 13%. So, you know, I say that we're not really going to get to change anything, but there are some things with different types of disc protrusions and bulges that can actually help to, or can actually decrease on themselves. So again, I just wanted to share some of this information with you. If you have any questions or anything, drop a comment below, send us a message on Facebook. Go ahead and like our page because we send out information like this a lot. We're going to be doing more videos just to help educate people on what we can do to help you get to feel